Fever during and after cancer treatment. In this video, you will learn important information about fever, what causes a fever, what you can do at home, and when to contact your care team. Important information about fever. You may have a fever and/or chills during your illness and treatment. Fever and chills are signs of possible infection. You have a high risk of developing a fever after chemotherapy, radiation, and while taking medications that could lower your immune system. It is important to contact your care team right away when you have a fever and/or chills because your body cannot fight infection when your white blood cells are low. What causes a fever? A fever can be caused by cancer treatment, cancer itself, or an infection. What you can do at home. Monitor your temperature as directed by your care team. We recommend taking your temperature by mouth because it gives the most accurate reading. To do this, place the thermometer into your mouth under your tongue in the sublingual pockets. Keep your mouth closed while you take your temperature. If you have any questions, please ask your care team. If you are unable to take your temperature by mouth, you can take it under your arm. To take your temperature under your arm, lift your arm up. Place the tip of the thermometer as high up as possible in the middle of your armpit. Make sure the skin in your armpit completely surrounds the tip of the thermometer. Lower your arm snugly by your side and take your temperature. Avoid using a touch or scan thermometer because your reading can vary based on how and where it is taken. Avoid drinking hot or cold liquids or eating hot or cold foods 20 to 30 minutes before taking your temperature by mouth because they can affect the reading on your thermometer. Clean the thermometer. After each use, clean your thermometer with an alcohol-based cleanser or antibacterial soap and water. Record your temperature readings. Write your temperature down each time you take it. Include the date and time for each temperature reading. This helps your care team look at trends. When to contact your care team. If you develop a fever, contact your care team before taking any medications to bring down the fever, like acetaminophen, which is also known as Tylenol, and ibuprofen, found in medications like Advil or Motrin. Contact your care team now if you have a temperature taken by mouth between 100.4 to 100.8 degrees Fahrenheit or 38 to 38.2 degrees Celsius for 1 hour or more, or a temperature that is 100.9 degrees Fahrenheit or 38.3 degrees Celsius or above, a temperature taken under the arm between 99.5 to 99.9 degrees Fahrenheit or 37.5 to 37.7 degrees Celsius for 1 hour or more, or a temperature that is 100 degrees Fahrenheit or 37.8 degrees Celsius or above. Chills or shaking chills, even if your temperature is normal. Cold symptoms such as a runny nose, watery eyes, sneezing, and coughing. New or worsening redness or swelling. New or worsening pain, including in your belly, back, sinuses, and mouth. This information is also included in the fever handout. Ask your care team for a copy if you don't already have one, or visit fredhutch.org/fever. If you have any questions or concerns about fever, please contact your care team. For more patient education videos, visit fredhutch/patient-education-videos or scan the QR code.